Afternoon. It's a pleasure to see so many people here today for our third talk in our federal benefit speakers series. I'm very pleased to present Walton Francis, who is the chief author of the Consumer Checkbook Guide to Federal Health Plans. And that's his subject for today. He'll give a short speech, short talk, and then open it up for questions. And I hope you'll keep the speaker series in mind. We've got several other topics that we're hoping to cover: survivor annuities and TSP withdrawals after retirement are probably going to be our next two topics. So with great pleasure, I'll turn it over to you. Thank you.
Thanks very much, Bonnie. How's my sound working? Coming through okay?
Sure.
You can all hear me?
Yeah. Yes.
Okay, great. I just want to tell you two things about myself, about me, because I think they're of modest interest. One is that I used to work for Judy Fader, who's spoken before you, and I actually counseled her on her federal employee insurance choices. So whatever she told you, right or wrong, some of it she got from me. And also, I'm a foreign service brat. My father, none of you are old enough, I think, to possibly ever know my father, but he was deputy chief of mission when Chester Bowles was ambassador to India. Nehru was still alive. It was a long time ago. But I lived a good chunk of my life abroad until I settled down in D.C. as a civilian fed. I'm here to talk to you about open season, about choosing a health care plan. I'm going to give you, in summary fashion, a big chunk of my advice. But what I'm going to tell you is a small fraction of what you already have available, which you may or may not have looked at yet. But the American Foreign Service Association does subscribe to Checkbook's Guide to Health Plans on behalf of all its members, and that you get online. We actually have a physical book, which I'm holding in my hand. And for many purposes, I prefer the book because I can flip to the right page and find something fast as I'm talking to you. But in the online guide, we can do a lot of things that we can't really do in a small book. And I'll give you one example, and others has come up. For the D.C. area, unfortunately not yet for the whole United States, and never, I'm sure, for the world, we do provide you a Dr. Find feature such that you can enter the name of your physician or physicians. And in that first page of results, that screen of results you get comparing plans, we tell you not only which plans are the best buys, but which plans your doctors are in, okay, as well as information on plan quality. So we design the website to try to bring you the best possible information based on what we think we happen to know people most want to know. You know, it turns out, and we've done a lot of research on this, and so have others. People hate health insurance. They hate choosing a health plan. They don't want to look at brochures. They don't want to think about it. It's like going to the dentist. All right, we know that for sure. When they do look at it, we know they mostly care about cost. And I'm mostly going to talk to you about cost. Secondarily, they care about, is my doctor in the plan? And on a distant fourth in that list is, what's the, quote, quality of the plan, however measured. So I'm going to talk mainly about the things you most care about, but I'll even talk a little bit about quality. What we do in the guide is compare all the health insurance plans available to federal employees and retirees, anywhere in the world, for that matter, not just the country, and figure out how well you're likely to do under Plan A versus Plan B versus Plan C, taking into account, obviously, where you live, because the plans, there's national plans, but there's local plans, how old you are, how many people are in your family, what pay system you're in, and what's your health, a few other variables, because it turns out that what you pay or costs you expect to incur vary radically depending on those answers. Most people who aren't deeply into the game of health insurance don't know this, but it turns out that anyone under the age of 25, whether a kid or a young adult, is going to cost per year in actual use of the healthcare system, on average, under $2,000. Anyone 65 and older in use of the healthcare system is going to cost, on average, $15,000. Okay, more than 7 times more, and all the ages in between go up that ladder of increasing costs. So it makes a really big difference. Two 50-year-olds don't have the same cost profile as two 25-year-olds, And even two 25-year-olds with a couple of kids, they are still cheap compared to the more elderly among us. And all this affects, your healthcare costs. Another obvious variable, you probably don't know about this, but if you are an active employee, the cost you pay for the premium of Plan X is reduced about a third from the premium you think you're paying. And it's reduced about a third because you get something called premium conversion, which is a tax preference, and it never shows up in any piece of paper you're ever given. But if you, at the end of the year, you check carefully your W-2 statement against how much you actually earned, you'll find that if you joined a plan where the employee share was, you name a number, $3,000, they will lower your taxable income by $3,000. And since almost any federal employee and almost any federal retiree is in a much higher marginal tax bracket than you think you are, taking into account federal, state, local, OASDI, Medicare taxes, you're probably paying at the edge of your earnings or the edge of your retirement check about a third of what you get in tax. So it's a one-third saving. We actually have a chapter in here calculating how that looks at different, but basically it doesn't really matter whether you're, I've already forgotten the FSO ranks, but whether you're an FSO 8 or an FSO 2 or something, it's going to be, your marginal tax rate is very likely to be up there in the 30 to 40% range. So what we do, we compare plans, taking into account what's the premium cost to you, depending on whether you're self-only or family pay system, etc. That's a for sure expense in each plan, and what you're likely to pay out of pocket in each plan. A number that varies, obviously depending not only on average expenses for people in your situation or families in your situation, but depends on the luck of the draw. I mean, you have a heart attack or you don't. You have a stroke or you don't. You have cancer or you don't. Knee replacement, hip replacement, who knows? Sometimes you know about those things ahead of time, sometimes you don't. Mostly we don't know, and indeed the whole purpose of insurance is to protect you against those financially horrible expenses you face. I mean, there are people who incur $1 million in healthcare expenses, and if you don't have good health insurance, you're wiped out. So that's your main purpose. Anyway, we calculate likely expenses to you when your healthcare costs are very low, when they're not quite so low, but still fairly low, when they're medium, when they're higher, and when they hit those plateau levels, okay, under all circumstances. And think of it as we compute the low profile year, the high profile year, and the average year. And the average year is a year, typically, it's not that we all tend to spend somewhere near the average, it is that a few people have these multi-$100,000 expenses, and most of us are a lot lower. Nonetheless, it's a predictable number. So we use actuarial methods to calculate likely cost to you under, again, Plan A versus B versus C. And the differences you find are not as big as the premium differences, but they're pretty big. And so the plan, this is one of those cases where joining the plan with the Cadillac-sized premium, you think it's going to give you a Cadillac-sized better benefit? No, it won't. And likewise, the El Cheapo plan may actually have equal or better benefits than one of the more expensive plans, and they often do. All this further complicated because there's so many kinds of plans. They generally fall into three categories, but there are exceptions. There are the HMOs, where the plan has a panel of doctors. It may be a very big panel, or it may be a strictly smaller in-house group like Kaiser has. A panel of doctors, as long as you're using those physicians, you pay close to nothing for your health care, but if you go out of network, you pay it all. Second group of plans are the traditional fee-for-service PPO plans, Blue Cross Standard, Foreign Service, Compass Rose, APWU, NALC, GIHA, etc., and I'll be talking about most of those as we keep going. Those plans now all have, with one exception that's very important, the following structure. They also have panels of preferred providers, big panels. If you use a preferred provider, we pay most of the expense, not quite as good a deal typically as the HMOs, and if you go out of network, we'll pay some of your expenses. And the typical formula for out of network is we'll pay 70% of what the plan allowance is for whatever procedure you've got. Well, in the real world, that works out that if you're lucky, they'll pay half. Because the plan allowance is a discount number that only the preferred providers get. The doctors who are not in network are the ones who wouldn't take that lower rate, okay? So The procedure is going to cost you maybe double what it might have cost in plan, and you're only going to pay 70% of that much higher number, and they're just the brute reality of what we're talking about. That's a big group of plans. In that group, the big exception is Blue Cross Basic, which pays nothing if you go out of network. So they're very much in that respect like an HMO. Having said that, it's a plan we strongly recommend, and I'll get into our recommendations in a bit. The third group are really two slightly different kinds of plans, consumer-driven and high deductible. All those plans have a couple of features in common. They all give you some kind of savings account in the $500, $750, $1,000, $1,500 range, depending on whether it's self-only or family, or which plan we're talking about. And they all have a high deductible, $500, $1,000 for one person, or for family, double that amount. And the idea typically is, and by the way, every plan gives you free annual physical, all your shots, everything. I mean, that's been pretty much true for many years. But one of the effects of Obamacare, which the president calls it, so I feel free to do so, I will be glad to talk about it. It hasn't affected the FEHBP much, but that one of its effects is that preventive benefits are now, Cadillac level. Okay, if I use that analogy again. So whatever plan you join, you're getting your free physical, and your kids getting their free vaccines and so on. Or adults get your free vaccines, like the one everybody should get against shingles. In a high deductible consumer-driven plan, you will get your physical, if you choose to have one. You will then pay, typically using your savings account, the next $500, $1,000 of bills out of that savings account. Then you hit the cliff, and you pay the next $1,000 plus out of your pocket. The plan pays nothing, and then regular insurance kicks in, and the plan pays 90% more or less, depending on which plan we're talking about, up until you hit a catastrophic limit of the most you can pay. All FEHBP plans have a catastrophic limit. They are not all loophole free, but in the high deductible and consumer-driven plans, they are, with minor exceptions, loophole free, and they are all excellent in protecting you against the worst. Very few federal employees join those plans, I think mainly because they're so stuck in their conservative choices. Most employees don't seem to be risk takers. Actually, these plans are not risky. They're safety. They're wonderful plans. But in any event, they're there, and they're available options for you, and they work across a huge range of circumstances, including people with Medicare and young couples and everybody in between. In general, those aren't good plans for people who have a large, predictable expense. Like if you have diabetes and you're going to be spending $5,000 a year on drugs, you probably don't want to be in a high deductible plan. But they're not undesirable per se for people who have high costs. In fact, quite the contrary. They're very protective if your costs go really high. One point about them, they have the ones that are called high deductible have something called a health savings account, HSA, pre-Medicare. The more general point: if you do not have other health insurance, okay, which for most people that I'm talking to today will be pre-Medicare, you can have a health savings account, and it works like an IRA on steroids. The money goes in tax-free, it accumulates tax-free, you can play the stock market, and it comes out tax-free. And you can grow it your whole life, and you can keep it for as long as you live. It's your money, it's actually an account. It's a savings account like an IRA. If you can avoid, you don't have to spend your HSA and your medical care. People explicitly choose to save it and pay more out of pocket as they burn through that deductible. Many people do that. Also, if you hit a catastrophic, very high spending level, you can augment it by adding more to your savings account. And once you hit, I forget the beginning age, but I think it's somewhere around age 50, you can make what are called catch-up contributions that are above and beyond what the government puts in. I'll stop there. If you have any interest in that kind of plan, you should take a look carefully. The brochures explain them very well for any of the plans that offer it. And they include, among the high deductible ones, include Aetna, GEHA, mail handlers, I'm forgetting one, but there's 3 or 4. And then there are an equal number, if not more, of the consumer-driven, including the same companies plus APW, the Postal Union. So that's your menu of plan choices. In the DC metro area, there are about 24 plans open to everybody. I suspect everyone I'm talking to is eligible for Foreign Service Plan. By the way, most of you will be eligible also for Compass Rose, the former association plan sponsored by the agency, but now kind of just like everybody else's plan. So you have a few more choices than most federal employees or retirees. And your problem in the open season is, which one do I choose? And again, we're back to who is going to read and understand all those horrifying, complex details, co-insurance, deductibles, co-payments, different premium levels, different restrictions on what you can do on different days of the week. No, they don't do that. But, very complicated. Well, we try to do most of that work for you. We can't do it all, but we do most of it. We do at least do all the complicated calculations. Like, what happens if your expenses run X dollars, and some are drugs, and some are docs, and some are hospital? How well off are you in GIHA versus Blue Cross Standard versus Blue Cross Basic versus, Compass Rose, you name it, okay? We make a series of those calculations for you to at least give you a ballpark. As I said, we do high, low, and average, and actually more than those. And if you go online, you can see you can drill down and see as much detail as you want about possible cost exposure. What we find in reality, by the way, the premiums vary for a number of reasons, one of which, though, is simply some plans have a disproportionate number of older and hence on average sicker people. And that's the main factor that accounts for the big premium differences. Few plans, GIHA high option, SAMBA high option, don't write those names down, just stay away from them, have kept loyal customers all their lives. And a really bad thing happens. Those loyal customers get older and more expensive, and the plan's premiums go up and up and up. Blue Cross Standard, the most popular plan in the system, has almost half, may actually still have half of all federal employees and retirees taken together, is not one of the better buys in the system. It's full of older people who cost more, and the plan has to cover the cost of those who enroll in it. So I like to make a lot of comparisons, say, against Blue Cross Standard, and talk about how much you could save being somewhere else, not because I want to pick on the plan. For many people, it's the right choice, believe me. I cannot tell you how many people I've counseled to stay in that plan. But it's not always or even usually the best choice. And there are many obvious alternatives. Blue Cross Basic, GIHA Standard, APWU, most of the high deductible consumer-driven plans, about half the HMOs in this area, both Kaisers, the Aetna Basic option, those plans are all a lot cheaper. And we're talking about savings for self-only, and I do this little calculation. The top 12 most expensive plans and the least 12 expensive plans, on average, what do you save by moving from one of that top 12 to the bottom 12? And the answer is something like, for self-only, close to $1,000 a year, and for families, something like $2,000 a year. That's a fair amount of money. Particularly in a world of pay freezes, if you can give yourself, say, a $2,000 raise just by changing health plans, why not? Now, which plans are better for which people is a very complex question and a complex answer because there's so many variables, not least of which is, are you one of the people that loves HMOs because it takes decision-making to some degree out of your hands, or hates them for that same reason, okay? You want to, do you want to be able to go out and network? It's really important to you or not, and so on. They're all, okay, is your doctor in the plan? Many reasons why you might like or dislike Plan A versus Plan B. We try to deal with most of them for you in a systematic way. You, for example, either in the book or online, you don't have to look at that part of the table that covers the HMOs if you're not going to do HMOs, okay? So you can, we're not asking you to look at detailed information on all 24 plans if they aren't the 24 you're interested in. So you can narrow your choice down a number of ways. But the main way is to narrow it down because the average cost in Plan A is going to be as much lower, as I just said, than in Plan B. So now the question is, why stay in Plan A when you can have this other alternative? What we always recommend for anybody, let's say you really are comfortable where you are now. At the very least, think about your health situation and your families. Number two, take a look at the brochure. Remind yourself, a couple pages from the end, there's a summary of benefits. Is that a list that you're comfortable with? And in section 3, I think it is, anyway, it's about usually around page 10 or 12, how do we change this year? You really don't want to stay in the plan if they drop that, special benefit you've been counting on for your peculiar, or maybe not so peculiar, condition. at least do that much. You can do that in 5 minutes, and you can do it online. The other thing you can do online is, let's say you're interested in a particular benefit. I don't care what it is, hearing aids. Now, we give you a summary table on hearing aids, so you can use our guide to kind of zero in on the 2 or 3 plans that probably have the best deal. But the table isn't a real substitute for actually seeing what the plan brochure does on hearing aids. So you load up 2 or 3 plan brochures side by side on your computer screen. Better have a big one if you're going to really do it side by side. And search each brochure for the word hearing. Bam, it'll take you to the page where hearing aids are discussed. You may have to go through a couple of previous mentions, or maternity benefit, or you name it. Whatever is of interest to you, it's easy to find in the brochures. They're in a standard format. They're explained pretty much in parallel and reasonably clear English. And, you know, to the credit of Office of Personnel Management for figuring out that people really need to be able, I mean, insurance policies are very hard things to read in general. The FEHBP, believe it or not, they're much easier to read than they are typically in the private sector. So you can compare features that matter to you a lot. Let's say it's a particular drug you take. We tell you which plans are better for prescription drugs, generally speaking, and they vary quite a lot. But if your drug, your name brand drug that costs $200 a month, if it's not on the preferred drug formulary for Plan X, you don't want to be in Plan X, even though it's otherwise a great buy. Well, we don't do for you all the drug looking up, but you can go to the website of any of these plans and look up their drug formulary and find out whether the drug is reasonably well covered or not. That in general is what we do. We take a lot of trouble to deal with Medicare because it's so important for all of us who do reach the age of 65. And let me talk first about some of our recommendations for better buys. 2 or 3 of them just to give you a feel for this. There are more. I won't mention them all. I'm sorry, that's not because there aren't plans just as good or just about as good as the ones I mentioned. GEHA standard option. It's got the lowest premium of all the PPO fee-for-service plans in the system, and it's a very good plan in almost every respect except one. You pay 50% of the cost for name brand drugs. So if you're an expensive user of expensive name brand drugs, you don't want to be a GEHA standard option. Actually, there's a footnote exception to that for people on Medicare, which I'll come to. Okay? Blue Cross Basic, a very good buy. Almost as low a premium, and if anything, slightly better benefits than GEHA standard option. Won't pay you anything out of network. All right? Every plan has its strengths and its weaknesses. Kaiser, you know, you're in their network if you're in Kaiser, and so on. There are so many possibilities. I like almost all the high deductible consumer plans. I think they're just great deals for almost everybody. But you got to be willing to accept the proposition that there will be that window of $1,000 or more where you're paying the entire bill before insurance kicks in. And some people love that. It helps you. It's meant, by the way, to make you a frugal shopper. It's meant to make you think about all your healthcare spending. If I use up my savings account, then I'm going to hit that awful donut hole deductible. Okay? And that's one reason those plans save money. There have been studies showing that high deductible plans, Rand Corporation just did one a few months ago, high deductible plans save on average roughly 15 to 20% of the healthcare spending that would otherwise occur in the people who enroll in them. Because a little bit of market pressure turns out to make us all better consumers. So those are a handful of the plans I rate as better in almost every circumstance, and that same rating that I just told you about applies to those of us on Medicare. Now, Medicare is a complicated issue, but there's sort of 2 paths to think, and to simplify it, it's 2 directions. First, when you turn 65, you get Medicare Part A for free, and you better take it, or else you can't get your Social Security benefit. It's one of those weird gotchas that the federal government wrote into law 50 years ago for no good reason. So you're going to have Part A, no premium, and it covers you for hospital care costs. Most of the plans, and here I will broadly differentiate the PPO fee-for-service plans, all of them give you the following deal. If you have Medicare Part A, except Blue Cross Basic, if you have, again, it's an outlier there in that group, if you have Medicare Part A, you will pay nothing for hospital bills. Then if you have Medicare Part B, they say you will pay nothing for doctor bills. All that same group of national PPO fee-for-service plans. Well, a couple of hitches. One that's of particular importance to this group if some of you plan to live abroad or something. Medicare doesn't pay anything abroad. So, how well that works out for you is, and we can talk about that. I'm not sure. I may ask someone to inform me on how some of this works when you're abroad. So Medicare A, hospitals, Medicare Part B, doctors, it seems like a no-brainer. Okay, I'll join Medicare Part B. For most people, next year, that's going to cost about $1,300 per person. Doesn't sound like a whole lot of money. I will just tell you one interesting number. If you have Blue Cross Standard Option Plan and Medicare Parts A and B, and you're a couple, your total premium cost next year, the amount you'll spend before you see a single doctor, will be over $7,700. Okay? So the question is, that's a lot of money. Can't you get a better deal? And the answer is yes, you can. And I'll come back to that in a second. But there's another issue with Part B, which you don't have to take, by the way, and you can take it later, after age 65, at any time you pay a 10% of your penalty. Okay? Or you can have taken it for 5 years and drop it. It's okay. Rejoin it 5 years later and pay another, that same deal, 10% of your penalty. So you have a lot of flexibility at a cost on Part B. There's one area in which it's not so flexible. There is something called the income-tested premium, which will probably hit those foreign service retirees, maybe all. The income-tested premium says if your adjusted gross income last year, it's a one-year look back, was $85,000 or more, and there's a few extra little footnotey things I'm not going to talk about, but that's, that's adjusted gross income. It's a number on your Form 1040 that you filed for the year 2011, which, that's the year they're going to look at. If that number, on line whatever it is.
34, I think.
Okay, very good.
34.
Yeah, and and there's a slight adjustment you make to it, but it's for, I forget what, state and local bonds or something. But if that number is 85 grand or more, you're not going to pay the regular premium. And the amount you can pay for Part B premium under that system, depending on just how high your AGI is, can be double or triple the regular Part B premium. For couples, the amounts are double. It's $170,000. But of course, if you both were fairly high-ranking, either public or private employees, you're going to be up somewhere in there, if not over, and you face the same problem. This number is not, this threshold is not adjusted for inflation. It's going to stay there. So if you're one of those people whose retirement income is right near that level, and it's going to go up every year with inflation, because there is an inflation adjustment, you're going to hit it. And the question then is, do you want to have Part B? Yes or no? And I will talk a little bit about that choice, and then we'll do Q&As, and we'll talk a lot more about it. But there are a couple different ways to think about it, and there's a couple of pluses and minuses. One way to think about it is, what's wrong with that lovely health care plan I was in at age 64 that worked so well for me? Why did I have to, what made me change to join up with Medicare at age 65? The answer is nothing. There's no particular reason to sign up for Medicare Part B. I can say one of the previous speakers, I think you had one who argued for and one against signing for Part B. I argued both ways. And actually the decision really should be different for lots of different people. But the point is there is certainly no compelling need to be insured under two systems. And well, there's some, and pay that money for what arguably is hard, if you're already well insured, why do you need another plan? Well, there's some good things about having Part B, 3 or 4 of them. Briefly, it will pay in these plans with the wraparound I talked about. 100% guarantee if you have Parts A and B, you will not pay a nickel for doctor and hospitals. There's always a few footnote exceptions. And by the way, they don't give you that guarantee for drugs. And I'll come back and talk a little bit more about drugs in a bit. But for those, they'll pay some of your bills. You won't, instead of paying that $30 a visit copay, the plan will give you that visit for free. So you'll get a few $100s of that premium back if you have Part B, almost in any circumstance, sometimes more. That's one advantage of Part B. Another advantage is, and a huge one, is it lets you go out of network. In any of these national health plans I'm talking about, the normal deal is, remember, if you're in network, you pay nominal copays. Out of network, we'll really only pay about half. With the guarantee they make is in or out of network, we, the plan, pay 100%. So it gives you extreme flexibility on out of network. Okay, you don't even need to think about, is my doctor preferred in my plan. You do need to think about, does my doctor take Medicare? That's a different issue. But most doctors take Medicare. The great majority do. Even the great majority do accept new Medicare patients, which is a different question than do they accept Medicare. 90% plus accept Medicare. Much lower percent. I have never seen a good estimate, but I'll give you my sheer guess. 75%, 80% will take new patients on Medicare. But in any event, that's most doctors, okay? And you can always find one who takes Medicare. Even if your docs, you probably won't find one on K Street, but you'll find they're around. In Northern Virginia, where I live, almost everyone takes Medicare, for example. So that's the big plus of Medicare Part B. And there's a third plus, which is harder to evaluate. I call it political insurance. We're now in the year of the fiscal cliff. The Congress and the President are going to go through some spasmodic, hopefully sensible response. But you never know, okay? And one of the things they could do is do something bad, either to Medicare or to the FEHBP. And we can't know for sure what they're going to do. And even if they don't do anything bad this year, which is far and away the most likely outcome, who knows what they'll do a year or two or three or four down the road. So one reason to take Part B is political insurance. And that's not a trivial reason. On the other hand, you could always rejoin it. Probably if they do anything really bad, there'll be a special open season without penalties. Who knows what will happen? But you can't live your life on basis of, I assume the worst will happen, or otherwise, you go through all the so there's to take Part B, to be or not to be, take Part B or not take Part B. If you take Part B, it works pretty well with almost all the plans, okay? Even the ones that don't offer the wraparound guarantee. Think of it this way. You're a lifelong Kaiser user. You love Kaiser. But you worry a little bit about that possibility that you might come down with some, rare condition where the world's best surgeon is at the Mayo Clinic, and you don't want to use the Kaiser surgeon, and it's a $100,000 operation. What are you going to do? Well, if you have Part B, you go to Mayo Clinic, and Part B pays for it. Or Parts A and B together pay for it. So it gives you out-of-network flexibility, even if you don't expect to use it, even in an HMO. I might add, by the way, Kaiser, there's actually 3 ways, if people want to get into the weeds, I won't do it now, but if there's special, we can do Q&As. There are 3 ways to be in Kaiser and Medicare. Okay, it's complicated. But think of the simple model. You're in the regular Kaiser FEHB plan, and you have Parts A and B on the side. That works fine. And that's true for any HMO. Parts A and B work well with the high deductible plans, because a funny thing happens in a high deductible plan. When you have Medicare, and you hit that donut hole high deductible, Medicare is covering your cost. So, even though the plan doesn't explicitly guarantee you anything, you have just lowered your risk of high costs in that plan. All that said, it's pretty pricey to have it. Now, my particular recommendation for those with Medicare Parts A and B who do not want to venture into the world of HMOs or the world of high deductible plans is to take a very hard look at GIHA standard option. You will get that 100% guarantee. You're going to compare it to Blue Cross standard. You're going to save a married couple will save $2,500 in premium. So instead of that number being $7,700, it's going to be about $5,000.
This is GIHA?
GEHA, standard option. And you can take notes, but let me tell you, if you get online, you're going to see it on your computer screen. Okay, we give the names of all the plans. We show you which ones are the better deals. You can click the thing that says, I've got Medicare Parts A and B, and we'll tell you which ones are cheaper and how much. And you can then compare them side by side on the computer. You can do lots of things, or you can download the brochures, which you must do if you're going to join a new plan. You really need to download the brochure and glance at it. You can't tell anyone to read all 100 pages. Actually, they're not. I was glancing at the foreign service one. It's 112 pages. The Blue Cross one is something like 150 pages. So this is... Anyway, so GIHA standard option, because you get the 100% guarantee on doctor and hospital bills, and the only real hitch in that plan is your drugs, but if you don't use expensive name brand drugs, GIHA pays for generics just as well as anybody else does. Everybody's in the realm of $5 or $10, pretty much everybody for generics. OPM's pushing generics very hard. The plans push them very hard because it's hugely to their advantage in keeping premiums down if they get you to use generics instead of name brands. And by the way, there's two kinds of drug substitution. One is truly a generic version of a name brand drug. It's the same chemical entity. The FDA says it is equally effective, as, there's Lipitor, brand name, and Lipitor, generic, and they're the same. And if you shop at Wegmans, you'll see a big sign these days, free Lipitor. Well, it's not, then there's a little bit of small print. It's not Lipitor, it's the generic, free. And Lipitor, and a year ago, before Lipitor came off patent, it was a huge, very expensive name brand drug among the statin group. But the other kind of drug choices you can make is to pick a therapeutic substitute. And the statin group's a good example of that. There's a whole bunch of drugs that reduce cholesterol. Lipitor is just one of them. Okay, Crestor, I don't remember, it's a long. They're all about equally effective, and they will typically be preferred in Plan A, but not one of them will be preferred in Plan A, but not Plan B, and so on. Well, there's always such a thing as say to your doctor, is there a less expensive drug for my condition? So be a standard option, particularly if you are able and willing to keep your drug costs down. But really, any of the other plans I've mentioned is good deals. I haven't, NALC, it's in the middle price group. It's not nearly as cost saving as GIHA, but it has a slightly better prescription drug benefit than Blue Cross Standard. So why aren't you, why are you in Blue Cross Standard when you could be in NALC? Okay, it's a good, I don't know the answer. I'm going to stop now. I've gone a little over half an hour. We'll do Q&As until you run out of the Q's. I'll never run out of the A's. And we'll stop, I think probably we'll stop at 3 or a couple minutes thereafter, but I'll hang around later for anybody that, in fact, I'll ask one Q and one A that people are embarrassed sometimes, but the other thing is we all learn from each other's questions. Mental health benefits. In fact, let me two quick things, mental health and then Obamacare. Mental health benefits, by law, there's now full equal parity with physical health benefits. There are no visit limits. There are no hospital day limits.
It's the mic on the.
Oh, well, we can get rid of you. Okay. So in theory, it's not an issue. In practice, of course, it's an issue because the plans all have some kind of restriction. Typically, we must pre-approve all visits more than 6 or something like that, or use our behavioral firm, or just you got to use our preferred providers. What you won't find is that they have a preferred provider that they let you use who's going to let you get analysis on his couch, 2 times a week, 52 weeks a year. They're not going to pay for unfettered, unlimited psychoanalysis. So you need to, and they probably they don't pay for your psychiatrist anyway because they tend to prefer clinical psychologists and other less expensive providers. That's an example of a benefit, and there are many others, where the smart thing to do before you choose a health plan, if you know you're going to have high expenses, okay, or you know this particular doctor you want to use, okay, or you're going to get that knee surgery or whatever, ask your doctor what plan or plans pay you best. And he may name some little-known FEHBP plan you never would have looked at. But it may be the one you want if you'd otherwise be several $1,000s or more out of pocket. The other thing you can do, for all of you who are still employees covered by your federal, not yet retired, flexible spending account. Anybody can set one up. That's the money you can set aside. It's called use or lose. The health savings accounts that I was talking about earlier is not use or lose. They stay. The HSAs are your money and stay with you forever. The HRAs and consumer-driven plans can accumulate, but they're not. If you ever leave the plan, you lose whatever your balance is. But the one-year money, the flexible spending account, is available for anything you know you're going to spend. The co-payments for your shrink visit, or the shrink visit that the plan won't cover at all, or whatever, or your co-pays for your drugs. You can chalk up a fair amount of money and put it aside to FSA. Just be sure you actually spend that money. Dental expenses. And by the way, I haven't talked about dental. I'll do it in Q's and A's if you want. We rate all the plans for dental coverage, including not just the standalone dental plans, but also the dental benefits in the regular plans, which are not usually much, but not trivial either. And in MDIPA are really quite, which is HMO, are really quite good. Obamacare has not had much effect on the FEHBP and probably won't. The big effect you all probably know about, covering your adult children up to age 26. So that even though they finish grad school and they can't get a job and they're at home and they're mooching off of you, at least you don't have to worry about them getting hit by a truck and costing you $1 zillion. Okay, So that's the biggest change that's affected you. I mentioned the preventive visits are a little more complete and thorough and totally free now, a little better than they were. Flexible spending accounts, one of the quote, bad things kicks in this year. Last year you could have put $5,000 in a flexible spending account. Next year it's $2,500.
Last year being 2011?
2012. We're talking now, I should be clear. I'm talking about choosing a plan now for calendar year 2013. In calendar year 2000, you also choose your FSA amount now. For that, in that choice, for 2013, you can only put away $2,500 in your FSA. You're okay for whatever you set aside for 2012.
Well, if you haven't done anything yet for 2012, can you do something now?
No, you only get to do it during open season. You had to do it in open season a year ago.
No.
Okay. Oh, should mention one more sort of housekeeping matter. The open season is annual. It's usually about a month long. This one ends December 10th for federal employees. There is a parallel Medicare open season, so actually 6 weeks long. This year it ends December 7th. You can pick, and I haven't mentioned Medicare Advantage, I can't believe it. Okay, you can pick any of 30 or 40 local Medicare Advantage plans that look a lot like FEHBP plans that are, in fact, the program's model of the FEHBP, and I'll tell you the financial benefit in a second. So you have an open season for that choice if you choose to go that road. You have an open season for the FEHBP, the health insurance plan, and you have one for flexible spending accounts, and you have one for joining or not joining either a dental or vision plan. So you have a number of choices. You have about 3 weeks left to make. Now, Medicare Advantage. I mentioned earlier, the problem with being in Medicare is you're paying 2 sets of premiums. Your FEHBP premium, which is the one you never drop, I hope. There are actually some very rare exceptions where you should drop it, but not many. And Medicare, well, there is another option. You can suspend your FEHBP enrollment. This is a year at a time. It's an open season choice. And during that year, you enroll in what's called Medicare Advantage. You have to have Medicare Parts A and B to do this. And that's a way, for example, you can join Kaiser. All the same companies, Blue Cross, Aetna, United, Humana, all the HMOs, they all have a Medicare Advantage plan. The Medicare Advantage plans typically cost you only the amount you're going to spend anyway in your Part B premium. But a lot of them charge nothing more. A number of them charge, an extra $50 a month or something, but it's not a break your bank account kind of number. They would all include the prescription drug coverage that comes with Medicare Part D. It's not as good on average, or rarely is as good as FEHBP insurance drug coverage, but it's not bad either. All the Medicare Advantage plans give you a catastrophic guarantee that's pretty bulletproof. It's usually around $4,000 for a health plan, and you have another possible $5,000 out of pocket for your drugs under Medicare Part D. But 4 plus 5 is $9,000 out of pocket, which is very competitive with FEHBP catastrophic guarantees. So that's another reason actually to have Part B, because you can always decide to go down the Medicare Advantage route, and it's certainly a way to economize right off the bat. I mean, go back to my Blue Cross Standard example. Blue Cross Standard plus Medicare Part B for a couple is, $7,700. Okay, the same couple, each individually enrolling, okay, in Medicare Advantage, because that Medicare is handles individual way. The cost now is $2,600. So that's a $5,000 saving. It's not as good a benefit, but it's not a bad benefit, and it's not far inferior. That has to be arranged through OPM. I'm going to stop. We're going to do Q&As, and that lady's been very patient. So you go first, and we're going to see how the sound works. I'll repeat it if it's not really clear.
Thank you. Very informative. One question. USAA has just launched healthcare. I wonder if you've looked at that and done any comparison. And my second question is, I had a boss 15 years ago whose dad was a doctor, said stick with Blue Cross. They've got the biggest negotiating authority, biggest network. Just stay with them. And so I kind of just did that. I'm retiring to Charlottesville, 3 hours south. How do we look at these in a different geographic region? Is there an easy way to check? Is the advantage the same when you're out of this, sort of massive medical area here?
Okay, good question. Let me just say, I don't know what the USAA thing is, and I don't think you should care. You cannot possibly find on the outside anything that's economical. The government is paying close to 3/4 of the premium for your FEHBP plan. Okay, in the world of dental plans, some of the private ones, there's no subsidy for the federal ones, but they are all using big networks and all their big advantage. For a dental plan, what you want to do is ask your dentist what plans are you affiliated with, and because the big advantage is using a network dentist. If you're not going to do that, why would you? Don't be in one. But back to your question about, you may recall the stories during the time of the Great Depression when all these wealthy widows went bankrupt. Because they had been told to buy railroad stocks and hold on to them forever by their dearly beloved, late departed husband. And they foolishly did what he told them. Okay? Now, Blue Cross, it has hardly any bigger network than the others. They all have huge networks. All the national plans do. It has all its bargaining advantage and all that, but hey, despite all that, its premium is higher. And that's what you care about. You don't care what rate Blue Cross or any of these plans negotiates with a particular physician. What matters to you is what it's going to cost you, not what the plan is paying someone else. So your cost is your share of the premium and the $30 or whatever you pay for a physician visit. So no, there's no particular reason to stick with Blue Cross. If you're moving to Charlottesville or any other place where you don't have pre-established physicians, it's probably a good choice. I'm pretty sure, as I recall, one or two of the HMOs may actually reach to Charlottesville, and there's actually a Piedmont plan that I think I'm not sure, you'd have to check. But I don't know that I'd want to join an HMO the year I'm moving into a new city and establishing new physician relationships. So I would say pick almost any of the national plans. If you think you know a couple of physicians down there who you're going to use or might use, you can use our .find tool won't work, but you can always call a physician office and ask what plans you're going to be with next year. And suppose you try your friends in Charlottesville tell you there's 3 good docs we all use. Check out all 3. What if they're in GEHA and Blue Cross? Okay. Or what if they're in Blue Cross Basic? Okay. Or what if they're in APWU? So that could influence your choice. Or you could say, I'll stick with Blue Cross Standard. I'm comfortable with it. I'll stick with it another year, and I'll make a different decision maybe next open season. Not a terrible choice. Man in the back.
What do you think of the foreign service plan, particularly for families?
Funny you should ask. I couldn't believe. We actually rate foreign service in almost every category as first, second, or third. I mentioned GEHA Standard as a plan everybody ought to look at. Guess what? Foreign service, too. So we find it's very cost effective. The plan seems to have done better than most of the others this year in keeping its premiums down. Yeah. Over the last couple of years, actually. So it's all of a sudden, 10 years ago, it's one of the higher price spreads, and now it's one of the most economical and frugal. I can't recommend it too highly. And in fact, that's another no-brainer choice. If you want to be lazy about it, why stay in Blue Cross Standard when you could be a foreign service plan and save X thousand? Lady over here.
And this follows up on what you were just saying. Aetna is buying out Coventry. Coventry is the underwriter for the foreign service health benefit plan currently. In your opinion, will the quality change once Aetna comes? Do you rate Aetna highly too? I don't have any idea how it will affect, but I know that's going to happen.
I don't know how to answer that exactly. These plans are always fiddling around with their network affiliations. They change from year to year. Quite a few of them use the Aetna network. Quite a few of them use the United network. I noticed GEHA actually tells you all the networks it uses and includes the United network and about 10 others because a lot of the networks are local to different parts of the country. I would have no reason to think that the network you're going to wind up in, first place, this may not have any effect for next year. And you could call the plan and ask them about that.
I knew it was going to happen sometime in 2013.
Oh, okay, but I don't know. Okay, sometime in 2013 it's not a very helpful answer. But the point would be this: if you have a particular physician you care about, find out if he's in that whatever the new network's going to be. Okay, remember I said. I actually, the way I say it usually is ask your physician what network he'll be in on January 1st. You may want to answer, in this case, a little more complicated question. You don't have to actually talk to the doctor. You can talk to the office staff. And, if they're in the... see, the problem is they're buying... You don't even know what they're going to do with buying Coventry, okay? Are they going to keep the Coventry network separate or, So maybe that's an uncertainty, maybe it bothers you, maybe for you, and I'm not saying it is, you might have a safer choice somewhere else where you know they're not going to muck around with their network next year. I'm sorry I can't give you a better answer. It's not in my control. Yes, ma'am.
I'm a little bit confused by your reference to the Affordable Care Act and covering physicals. So let me put it this way. I'm currently in a fee-for-service federal program.
Mm-hmm.
My annual physical is essentially, so far, my biggest expense. So at this point, my physical is subject to a $300 deductible and a copay, which, because it's a non-preferred provider, is at 70%. Are you saying that in 2013, the physical will not be subject to a deductible and it won't be subject to a copay, whether it's
No.
70
Okay.
or
Good,
30?
Good question.
Or 10 or 90 or what?
If you stay in network, you will pay no deductible, no copay, not a nickel, not a dime for your annual physical. And it will include the whole 9 yards, mammography, whatever is on your list. Yeah, and you can, by the way, look at your brochure. It'll tell you this.
I
But
find the brochures confusing.
well,
So
on this
PPO
point-
or not PPO?
the plan will tell you. Okay?
No, but I'm saying-
In general, they're not going to cover you 100% if you go out of network, no.
Even under the change with Obamacare.
Yeah.
So you're saying if you use a PPO in a fee-for-service program in 2013, you should have no cost to the physical, the lab work, and the doctor's visit.
Right.
But you're not commenting, which is perfectly fair, on what will happen if you go to out-of-network.
Oh, I think you'll pay. I know, I'm sorry. I am telling you, but the guarantee is for preferred providers.
Okay.
I'm just I'm glancing because it's, useful. I'm sitting here with my hand. Foreign Service brochure, okay? I'm on page 29. Preventive Care Adult. 1 routine physical exam to include a history, chest x-ray, yada, yada. Includes a gynecological exam, okay? Women benefits, including Pap test, human papillomavirus, etc. If you're in the PPO, nothing. No deductible. Non-PPO, 30% of the plan allowance and any difference between the allowance and the billed amount, which means to say you're going to pay half or more. Okay, so that's and they will almost all of them are just like that. Except Blue Cross Basic will say out of network, you pay it all, and the HMOs will say that. Yes, sir.
You said earlier that if you have Medicare and you take Medicare B, there's some advantages. I guess an additional one would be that they do all the paperwork if you have a Medicare B plus.
Yeah, that's a good point. We hadn't talked about paperwork. One of the reasons for joining an HMO is a couple. One of them is they pre-select. They're not going to have a preferred doctor who's one of these, fly-by-night kind of guys. They care a lot about at least some reasonable quality, and they keep your paperwork costs to nothing. Okay. The same is promised for people in all these national plans. They promise you if you have our plan plus Medicare A plus Medicare B, you pay nothing and we handle all the paperwork. The claim is generally true. I don't think it's always seamless and always without problems. I know it's not. But for most people, most of the time, yes, it's real simple, real painless. And they do take care of it all.
You said earlier that a gentleman asked about Foreign Service Benefit Plan. You said it's very good for a family. But if you're a retiree, that's a little different, isn't it?
No, it's an excellent for retirees. I'm sorry, I want to be clear. When I tell you that plans A, B, and C are good for almost all categories of people, I mean to be saying self-only, families, young, old, retired, not retired. I mean, I'm trying to tell you there's certain plans I'd steer you towards, no matter which of those categories you're in.
Last year, your recommendation was that if you had Foreign Service Benefit Plan, it would not make too much sense to have Plan B because you're paying extra money and you're not getting that much of return. Or did I misread that?
Yeah, I don't think I quite said that. I think I said last year. I think I say the same thing now that I said last year. There are advantages to Part B, to having it, but you will not get your money back 99% of the time, okay? So whether or not you want to incur the extra expense of having 2 insurance policies is a choice you want to make. I think people who won't sleep well at night, if there's any fear of something bad might happen under my FEHBP plan, should take Medicare Part B. People who want to minimize paperwork should take Part B. I mean, there's people who want political insurance should take Part B. I just want to make clear, you are going to pay a lot more money than you're going to get back in dollars in almost all services.
So you won't get back more than your copay, or your copay won't be anywhere close to what you're
What I'm
paying
trying to
now.
say is if you're paying $1,300 for Medicare Part B
You're not gonna
premium,
get
how many
that back.
$30 copays does it take
Yeah.
to get that
Right.
$1,300 back? And the answer is more than you're going to have. Lady in the back.
You said you took dental and vision. Are there any of those plans that would mean that you didn't also need to take out a dental and vision plan? So some of them say they have dental benefits.
Yeah, what they have is, and I always try to flip the page so I don't say something silly. Dental plan ratings. Oh, okay. Probably half the plans, roughly, have a preventive dental benefit. They'll pay for your annual checkup and prophylaxis and maybe fluoride, something like that. But that's about it. Maybe fillings, okay? But those are the cheap things. Yeah, maybe it's worth $100, or a little more even. All right. The exception, the one that offers more than that inside the health insurance plan, that's significant is MDIPA. Okay, it's well worth for those that are willing to join HMO. Well, we're taking a look, but if you want much better coverage, the problem is if you join a dental plan, they have to cover the cost of the people who enrolled in the plan. All right, and guess who joins it? People with more expensive problems. On the other hand, they get big network discounts. All right, so that's kind of what's going on. If you expect substantial dental expenses next year, I would almost for sure join. And there's a lot of variations. The Aetna has one, GIA has one, actually has two. Humana has one, MetLife has two options, United Concordia has one. They're all available, by the way, most of them anywhere in the world, believe it or not. And they have very different payment maximums as to how much they'll allow you to spend before they close. It's a maximum. It's the opposite of catastrophic protection. Most of them raised them this year. Some cover orthodontics, some don't. I think you'd have to go pull some brochures, compare them, but ask your dentist what dental plan are you in. That is the one time it's vital to ask that question. Yes, sir. You're very patient.
Yes, thank you. I have a question and a comment. The question is, I didn't quite understand what you said about Blue Cross Standard Option and Medicare Part B. You said it was an exception.
Okay, Blue Cross Basic.
Blue Cross Basic
does not wrap around with Medicare the way the other plans do.
But Standard does.
But Standard does.
Okay.
Now that doesn't mean it doesn't make sense. We actually rate Blue Cross Basic with Medicare Parts A and B as a better deal than Blue Cross Standard with Parts A and B because the premium is so much lower. Remember, I'm using as my example. It can be a little more complicated, but those $30 doctor visit copays. You have to run up an awful lot of those to make up either for the cost of Medicare premium but at least if you're going to pay that, so be it. But also, if you're saving $1,500 in the FEHBP premium to begin with, all right, it's.
But you have to be 65 to apply for Medicare, right?
Yes.
Yeah. Okay.
Yeah. Don't even think about Medicare until you're 65. I'm sorry. You think about you need to think 1 year at a time in this program.
Okay, the comment I have is that I don't know if other people in this room are having this problem, but I've had one doctor do this to me already. About 7 years ago, my doctor told me, I've had it with health plans. I'm not going to honor any health plan. I'm not going to honor Medicare Part A, B, C, or whatever. If you want to continue with me, you just have to pay up front and do all the paperwork with your health plan and see what you can get. And now my second doctor just told me last week that he's retiring. The reason he's retiring is that Medicare and the health insurance companies are driving him out of business with their paperwork and the cost it puts on him to hire employees to do this paperwork. And he said, I'm just retiring. And he said, good luck finding another doctor because you're going to find in this area that most doctors will not honor any health plans
Okay,
anymore.
well, all right. It's, okay, first place, it's not true that most won't honor the health plans. It's true on K Street, most won't honor the health plans. Okay, and yeah, it's a problem. It's a byproduct of this move towards preferred provider panels that's sort of taken over the world of health insurance in the last 10 or 15 years. And, you know, it's a huge aggravation. All of it. We all live with that problem, okay? The doctor we want to use doesn't take Medicare or doesn't take our plan. And, you know, and it's very irritating. Or he drops out and you got to change doctors or pay a huge amount out of pocket. There's no simple answer except, again, most doctors do take Medicare, okay? Most doctors do participate in health plans one way or another. You always have the HMO option where, you know, if you, I mean, in the most control of them is Kaiser. Kaiser has doctors right there on their payroll who are going to be there available when you want to make an appointment. If you can fight the bureaucracy, which is another little problem. So there's no answer to that except expand your horizons a little bit. A few years ago, a guy called me and said, I can't find a board-certified psychiatrist anywhere near where I live. And it was like, I forget, Bethesda or something, you know, Northwest DC, one or the other. And I said, I can't, who participate in any health plan? Or maybe he was saying Blue Cross. I don't remember now. Well, I remember, I went online. I looked up his health plan, which I think was Blue Cross. And I looked up how many board-certified psychiatrists are participating as preferred providers at Blue Cross within 20 miles of where this guy lived. And the answer was like 100. So, you know, he just wasn't looking. He obviously was looking at 2 or 3 and didn't want to, you got to look a little farther sometimes, either in miles or in your list. Lady in the back.
Yeah, thank you. I want to ask a question about quality. I had GEHA standard and found it very, very difficult to get. In this case, it was physical therapy, but this ongoing where, and in fact, my physical therapist office assistant just told me he hated dealing with United Healthcare, who deals behind GEHA. I have to change for other reasons from GEHA standard. I assumed it was because I was paying a low premium, less service. But you're saying no. So how do I know what the quality is when I'm looking at new plans?
Okay, well, I'm glad you asked, because there's a whole other feature of what we do, and it's compare plan quality. And I'm going to talk about the online version, because it does so much more than we can do in paper. We actually have a way to roll your own, you know, we give plans 1 to 5 stars like a lot of other people do. We let you pick how to weight the factors that go up into those ratings. So, for example, if you are diabetic and need, want a plan that scores well on it, there's a national exam that covers how well the plans deal with diabetes in their patients, you can give that a high weight, and you can give, keep paperwork down a low weight, or however you want to, rate them. And it'll press, click the mouse, and all of a sudden you got a plan set rating set just for you. Our sort of default in all this is a set of data on how do people who are actually enrolled in the plans rate their plans on things like keeping paperwork down, making it easy to get an appointment, yada yada. And GEHA does not score as well as some on that variable, and that might be, given your experience, probably a very important thing to you next year. And so I'd say try our quality ratings and see if that helps you narrow down your choices. That said, a lot of this is, circumstance specific. This may be a particular, maybe this particular provider doesn't really know how to work with the plan very well. Maybe United just doesn't do a good job with physical therapy in general. I don't know, so this is another one of those cases where I say, if you have physicians or other providers you want to use next year, ask them, A, what plan are you in, and B, how well am I treated in those plans? Is there, okay, and they will tell you, hopefully, if they have unusual problems getting the bills paid or whatever.
Someone told me they can't tell me that.
Of course they can't.
They said, no, we're not allowed to tell you which ones we like better.
Well, they're allowed to do anything they please. It's a free country. They might have signed a contract that says that. They could still tell you. If they know you. They might. Yes, sir.
Following up on an earlier question, how do you keep up with what's going on in the Washington area regarding the attitudes of medical professionals? For example, my GP, my internist said she was dropping Blue Cross because they're not paying her enough. And as I looked into it some more, I heard that a lot of the internists are doing the same thing. Or if you want to go to another internist at the Virginia Hospital Center in Arlington, you might have to pay, an extra amount during the year just to be in that practice because they're not getting enough back from Blue Cross Blue Shield. And they said that, and this is happening throughout the metropolitan area, that the pushback or the resistance to Blue Cross Blue Shield's rate setting is so strong that lots and lots of them are dropping out. I don't have any way of following this. Does anybody cover this in the online or in the media?
Nobody has good data on how many physicians participate in Plan A or Plan B or Medicare, but I hear the kind of stories just told all the time. I was actually, one of the times I was testifying on the Hill about a big FEHBP issue, my fellow panelists included some surgeons who were affiliated with Georgetown University Hospital, and I used my standard example of the plan allowance may only be about half what the physician charges. And at the end of the hearing, the guy came up to me and he said, it's not half, it's a lot less than half. Okay, so it's a problem. All I can say is it is certainly the case that a majority of the physicians in this metro area do participate in both Medicare and at least one or two of the provider networks. Yes, sir.
My understanding.
Excuse me, can I just? It's almost 10 after. Let's go. Maybe two more questions, and I will stay. But I want people who. It's okay to leave. Okay, and I don't want people to feel it's impolite or something, or they have to hang around. Yes, sir.
Related to Part B, my understanding is that there's a law that says the federal programs cannot pay more once you hit 65 than Social Security levels are. Is that correct?
Not as you said it, but I'm glad you asked because it's something I hadn't yet explained. There is a law that says once you have turned age 65, whether or not you have Medicare Parts A or B, no physician who participates in Medicare may charge you more than what's called the Medicare limiting allowance. So that you have actually an improved out-of-network benefit come age 65, even if you don't have Medicare, because the Medicare limiting allowance, which is 115% of the regular Medicare allowance, is this very low amount that doctors hate, okay, which is why some of them drop out. But, they have to know whether in the real world that's how well that's enforced is a different question. So it's a plus for you, not a minus, okay? Again,
As long as you have doctors that accept Medicare.
Yeah, but most do. My general advice is if you have any expensive medical procedure that you're going to have because you went to a doctor and he says you're going to have your left toenail removed all the way up to your knee or something, whatever it is, there's a set of questions to ask. How much are you preferred? Is my plan going to pay? Will you agree? I once counseled a woman with breast cancer who had no insurance, was going in for an operation later that week, okay, and knew she couldn't possibly afford to pay, what she was going to have to pay. And I asked her to do one simple thing: talk to both the physician and the hospital about, will you accept the Medicare rate? It's a very simple bargaining question. Not only did they accept the Medicare rate, she wound up getting, the hospital put her on its special, fund for people who don't have any money, and she wound up paying almost nothing for the whole deal, okay, for her mastectomy. So, you must talk to these people about money, even if you think you don't have to. You need to, if it's going to be a big bill, or possibly a big bill. Anyone who hasn't asked yet, yes, sir.
A lot of us this year were foreign service. I came back 2 years ago to retire. One of the things we haven't talked about is access to doctors, period. We live in the city, and getting an initial doctor, you can get on a waiting list, and some doctors in Virginia have this deal where to have access to a doctor, you have to pay to kind of join the club. Is this kind of stuff insurable?
This is the same question that's been asked. You're the very person to ask it. Oh, by the way, there are doctors who they have these VIP things. Pay us $1,000 a year, and we'll give you special, service. Okay.
I mean, it's hard to get a doctor. I had my insurance company tell me, go to the emergency room. I said, are you kidding? For something as small as this?
Go on the plan, you can go on any plan's website and look up the participating preferred physicians, okay? Internists, they're organized by specialty and so on. I think you're going to see a very long list of doctor names, right? Now, they won't be mostly on K Street. I cannot overemphasize that. But, you know, that's...
Capitol Hill is a black hole for doctors.
Well, that's saying, I didn't mean to, you know.
Yeah.
In the more affluent neighborhoods in and around the city, you know, close in Bethesda, you know, I'm sure Capitol Hill, you know, yeah, it could be a real problem. You're going to have to look a little farther than some other people, but you will be amazed. There are a ton of them who participate. I really want to stop now, and I'll be delighted to answer more, but I don't want to abuse the patience of all of you.
I'm here to give a word. I mean from that place.